Good morning, and thank you to everyone for joining us today. I'm Monique Taylor. I am the MPP for Hamilton Mountain, and I am so pleased to be able to welcome Jagmeet Singh and Sarah Jama to the riding of Hamilton Mountain today, and to thank the many healthcare workers who we've had the opportunity to speak with this morning in a roundtable to discuss the stopping of privatization and the for-profit, which is happening today in our province in Ontario. And I know that Jagmeet will have some insight and some say about what's happening strictly right across the country. So I'll leave that and just welcome everybody today. And thank you for joining us.
Thank you.
Jagmeet.
Thank you so much, Monique. Really honored to be able to spend some time with my former colleague that we spent time together in Queen's Park, and Sarah Jama, the candidate for Hamilton Centre for MPP. Thanks for both of you for being here. So today we spoke about healthcare, and we spoke with healthcare workers here in Hamilton. And we know one of the major crises that we're up against as a nation is the healthcare crisis, and it's being felt here in Hamilton. People are struggling to get the care that they need. And we know healthcare workers are working as hard as possible to deliver care, but they're simply not able to. And we heard from those workers who are saying, our workers are burnt out, they're overworked, and they can't deliver the care that they're trained to deliver, and they want to deliver, and they're breaking down, they're feeling morally injured because they're not able to deliver that care. And it's because there's a worker shortage. That is the major problem that's been identified. There's a massive shortage of workers. Here in Hamilton, in the Hamilton Health Sciences Hospital, there are right now vacancies of critical nurses of 700 positions, 700 critical nurse positions that are vacant. And not to mention the other healthcare workers in general, and then physicians, that there's a massive shortage. We need to fill those positions. And the proposal of Doug Ford and other premiers like Daniel Smith to bring in for-profit private care does nothing to fill those vacancies. And in fact, will make that crisis even worse, because the for-profit private delivery will pull away workers that are in the public system working in emergency rooms and make those delays and wait times even longer. The hours that people already have to wait will get even longer when those workers are pulled out of that system, cannibalized out of the public system into a for-profit private system. And with the for-profit private system that Doug Ford claims is going to be good for people, we know costs go up. There's upselling where people end up paying out of pocket. Quality goes down when there's for-profit as corners are cut to make more money. And the delays and the crisis just get worse. This is the wrong approach. And instead of fighting back against it, we've got a Prime Minister Trudeau, who's applauding this for-profit private delivery as innovation. That is absolutely the wrong approach. It is not innovation. It is wrong. It is going to hurt Canadians. It's going to hurt Ontarians. It's going to hurt the people of Hamilton, and we're fighting back against it. We want to see public delivery of a universal healthcare system. We want to invest more in our healthcare system and hire more healthcare workers. We need to retain the workers we have. We need to recruit more workers. We need to train more workers. We need to treat workers with respect to make sure people get the care that they need when they need it, that care is ready for them when they need it. So I wanted to make sure folks know here in Hamilton, you can count on us. You can count on your Ontario New Democrat team and us to fight for you to make sure healthcare is there for you when you need it. Donc, je veux encore dire que comme des partis néo-démocrates, on défend le système de santé publique. On sait qu'on est dans une crise de santé publique. On a parlé avec les travailleurs, on vient de parler avec les travailleurs. Ils ont partagé les histoires. Le grand problème, c'est un manque de travailleurs de santé, une pénurie de travailleurs. Donc, ce qu'on propose, c'est qu'on doit investir dans notre système de santé et embaucher plus de travailleurs de santé. Ce que le Premier ministre ici en Ontario propose de privatiser à but lucratif notre système de santé est la mauvaise chose à faire. Ça va empirer les problèmes et on oppose cette position, on s'oppose. Le Premier ministre a dit que la privatisation à but lucratif, c'est innovant. Il est tort. Ce n'est pas la bonne chose à faire. Ça va nuire et la situation, ça va augmenter la crise, ça va empirer les choses. Donc, on va continuer de défendre notre système pour que vous puissiez avoir accès aux services quand vous avez besoin. Merci. With that, I'm ready for any questions that you might have.
We're going to start with questions on site. We'll do one question, one follow-up. We'll start with CH.
Hi, Mr. Singh. Thanks for taking my question. You're calling on the Trudeau government to do more to fill the 700 vacancies at Hamilton Health Sciences right now. What specifically would you do if you were Prime Minister to fill those 700 vacancies?
As Prime Minister, I would take a completely different approach. I would be investing immediately in a public healthcare system, and we would be working immediately to hire more healthcare workers. So what we can do at the federal level, we can invest in dollars in our healthcare system that go with strings attached to hiring more healthcare workers. I would invest in training more healthcare workers, supporting that training so it happens locally as well. We can use the immigration system to accelerate the recruitment of internationally trained healthcare workers and work with provinces to qualify those trained internationally in Canada, where we got so many healthcare workers that aren't working in their fields because it's become so difficult and onerous to get qualified in Canada. Those are workers that should be working in healthcare that aren't right now. But fundamentally, with the negotiations coming up next week with premiers, the federal government, Prime Minister Trudeau, has the opportunity to stand up for public healthcare. As Prime Minister, that's what I would do. I would say unequivocally, I believe that healthcare has to be public, and that what we need to do at the federal level is invest in it with enough funds and ensure that we're actually hiring healthcare workers, not putting more money into the pockets of private companies.
Do you have a follow-up?
Yes, I do. As I understand, you want the feds to use the Canada Health Act to try and prevent the Ford government from using their model of for-profit clinics within the public system. I've spoken with several academics, experts who say that the Canada Health Act actually doesn't prohibit what the Ford government has proposed. I'm wondering what your response to this, and do you read the Canada Health Act in a certain way that makes you think you could use it to prevent Ford from doing what he's planning on doing?
Well, the Canada Health Act can be used in other examples where there's been violations of the principles of the Canada Health Act. But with the specific program that Doug Ford's proposing, what the federal government should be doing, and what I would be doing as Prime Minister, would be negotiating that no cent of federal money will go to those for-profit private clinics. We can negotiate that in the contract right now. So there's other areas where we should enforce the Canada Health Act. And on this particular point, though, I would be using the negotiating powers to say, well, if we're going to spend public money, hard-earned public money from people that are struggling right now because the cost of living that's so high, every cent of that public money should go to public delivery of care. Not a cent of that should go to enriching a private corporation that's using for-profit services to make money off of people. I don't want that to happen, and I would negotiate to not let that happen.
We're going to go to questions from journalists on Zoom now. If you have a question, please use the raise your hand function. Si vous avez une question, utilisez la fonction lever la main, s'il vous plaît. The first question, la première question, is from Madeleine Blais at Radio-Canada.
Je pense que peut-être vous êtes sur sourdine.
Monsieur Singh, est-ce que vous m'entendez?
Oui, merci.
Bon, formidable. Monsieur Singh, j'ai des questions à propos de C-21. J'aimerais savoir, qu'est-ce que vous pensez de la gestion du gouvernement dans ce dossier-là? Avez-vous l'impression que le retrait des 2 amendements sont temporaires? Est-ce que vous êtes en faveur qu'ils soient réintroduits avec une définition peut-être différente, mais quand même une définition des armes d'assaut prohibées?
Merci pour la question. Donc, on a dit que les amendements, en général, en commençant avec votre première question, la gestion de ce dossier était un échec. C'est clair que le gouvernement libéral n'a pas fait le travail nécessaire et ils ont mal géré ce dossier. Ça, c'est clair. Donc, avec l'amendement, on a soulevé les inquiétudes avec les 2 amendements que les communautés autochtones ont dit que c'est problématique et aussi que les pêcheurs, les chasseurs ont soulevé aussi les inquiétudes. Donc, on a dit qu'on doit enlever cet amendement. Donc, on encourage cette décision parce que finalement, on veut faire passer des projets de loi qui défendent la communauté. Et à cause de la mauvaise gestion des libéraux, ils ont mis en péril le travail nécessaire de protéger notre communauté. Et je veux aussi ajouter, je veux prendre des mesures nécessaires pour protéger notre communauté. Mais avec les libéraux et les conservateurs, il continue continue avec un jeu politique où il divise la population et il le fait par exprès parce il gagne un bénéfice de créer des divisions entre les conservateurs et les libéraux. C'est leur jeu politique. Pour nous, comme des néo-démocrates, on veut aller de l'avant avec un bon projet de loi qui protège la communauté. J'appuie les mesures pour mettre fin aux armes de poing, parce que je sais que la violence dans les villes, c'est quelque chose vraiment frappant, c'est vraiment choquant. Donc, on doit prendre les mesures pour les protéger. Aussi, on a des mesures pour protéger les victimes de violences conjugales. Ça, c'est aussi important d'avoir ces mesures. Donc, on appuie ces mesures, aussi une définition qui fonctionne pour bannir les armes d'assaut. Donc, ce sont des mesures importantes, mais les libéraux ont mal géré le dossier et à cause de leur mauvaise gestion, on est dans cette position.
Donc, en suivi, M. Singh, si je comprends bien, vous seriez en faveur d'une réintroduction d'un amendement qui parlerait d'une définition des armes d'assaut prohibées, juste pour vérifier. Et si vous êtes capable, s'il vous plaît, de me dire un mot sur le ballon chinois, ce que vous pensez de toute cette affaire-là? OK.
Je commence avec le ballon chinois. J'ai entendu le fait que les excuses données par la Chine, j'ai des inquiétudes. Je pense qu'on doit travailler avec nos homologues aux États-Unis pour avoir une enquête, pour vraiment enquêter ce qui s'est passé et pour toujours faire attention aux sécurités nationales, sécurité internationale. Donc, ça, c'est une inquiétude que j'ai voulu partager. Avec les amendements pour l'avenir, on ne sait pas qu'est-ce que le gouvernement va introduire encore, mais oui, on appuie les éléments de bannir les armes de poing. On a toujours dit ça. Une définition qui fonctionne pour bannir les armes d'assaut qui fonctionne, une définition claire, une définition qui protège la communauté, c'est quelque chose on est prêt d'appuyer, mais ça dépend aux détails, donc c'est quelque chose qu'on va voir. Mais en général, je veux encore répéter que ce qu'on a vu avec les libéraux et les conservateurs, c'est un jeu politique au lieu de vraiment prendre au sérieux cette menace, ce problème, et de prendre au sérieux la responsabilité de protéger les communautés. La sécurité, c'est quelque chose de vraiment important et on le prend au sérieux.
The next question comes from Peter Zimonich from CBC.
Hello, Mr. Singh. I don't know if you can hear me or not.
I can hear you.
Okay, great. I'm not sure. I had some technical difficulty, so you may have addressed this already, but I didn't hear it. The Liberal government's decision to revoke amendments on C-21. Could you respond to that, please?
Sure. We said that the amendments were problematic because of community issues or community concerns raised by Indigenous communities who said that this would impact their Indigenous rights, their inherent rights, their treaty rights. Concerns raised by hunters and by people who make a living off of using tools in their community. And so those are concerns that were raised, and based on those concerns and the really horrible management of this file in general by the Liberal government, we were concerned about these amendments. So I think it's a positive step that the amendments have been removed. But I want to be very clear about this point. We believe in keeping our communities safe. Our communities have been seriously impacted by gun violence, and we want to see bills that actually keep our communities safe passed. I've spoken with healthcare workers who have seen the trauma of gun violence and want to see our communities safer. We've spoken with people who have been the victims in terms of community violence, have seen the impact of it on their communities, of gun violence in their communities. So we want to make sure laws are being passed that actually keep people safe. But what we've seen from the Conservatives and the Liberals is that for them, this is a political game. They're dividing each other. They want to wedge each other purposely. It's to their benefit to create wedges. We are not interested in wedges. We are interested in keeping communities safe with good laws that actually achieve the goal of keeping communities safe. And so far, The Liberals have been more interested in playing a game. The Conservatives also want to play a game. They've never been interested in some of the fundamental parts of this bill, like the handgun freeze, which we support, measures to protect victims of domestic violence, to protect them against any future violence. Those are important measures. We want to see those passed. But because of the really poor management of this bill, those have been put in peril. And we hope that we can move forward with the really important work of keeping communities safe.
Thank you. That works for me. I did have one quick follow-up on.
Sure.
You make the comment on separately about you want healthcare to be universal and publicly funded. Dental care is not that. It is the government paying private people to do services. That seems to work for you. I'm having a difficulty connecting those two things. Could you please explain?
Absolutely. We already have an existing public system when it comes to healthcare, hospitals and delivery of healthcare services. We want to strengthen that public system and invest in it. When we already have a public system, we don't want to see the encroachment of private delivery of care when we already have a public system. And when the problem in the public system is a shortage of healthcare workers, we want to solve the crisis. The private for-profit delivery of care won't fix the crisis. And in fact, based on all the evidence, will only make it worse. So we've got an existing public system that's been starved of funding, and the problem is not enough healthcare workers. And a for-profit private delivery doesn't create more healthcare workers, and in fact will cannibalize the existing workers in the public system, in the emergency rooms, in the children's hospitals, and only make the delays worse. So it is very clear that that is the wrong thing to do on principle, but also on evidence. With dental care, it is already and only a private delivery of care. We ultimately want to bring dental care into the public system. Our first step, though, is to cover people, the 9 million plus Canadians, nearly a third of Canadians that do not have covered, or a fourth of Canadians. 1 in 4 Canadians, 1 in 4, 1 in 5 do not have coverage. We want them to get coverage now, first and foremost, to cover those nearly 9 million Canadians, and then move on to ultimately bringing dental care into the public system.
Your next question comes from Michael Toe.
Thanks.
Hi, thank you. I'm from CBC Hamilton. Sorry if it seems like a double CBC question.
No worries, no worries.
So my first question would be, some nursing and health practitioner communities within Hamilton and Niagara mentioned that they have left Ontario for positions that offer better funding, wages, and incentives for lower mental stress, including out of the country. What do you propose from the NDP to address this?
First off, that is a very serious concern, and it is a real concern. Healthcare workers love their profession, but are being burnt out. They're being overworked, and they're not being respected. Basic things like families, a worker that goes in has to make this really impossible choice between patient care and their own health, because they can't take time off. They can't spend time with their families. They don't know what their schedule is going to be. They go into work not knowing how long their shift is going to be, mandatory overtime hours. These are really difficult conditions for anyone to work in, let alone a healthcare worker who's got to deal with life and death decisions every moment. So this is incredibly difficult. And why we're saying the first and foremost step we need to do is retain the workers we have. And to do that, we need to improve their work conditions. We need to ensure that we improve their pay. And these are things that we can do. One of the things that we can do to improve work conditions is to hire more healthcare workers. Nurses are telling us that there's a massive shortage. Here in Hamilton, like I indicated, at the Hamilton Health Sciences Hospital, 700 critical positions. That's not all the positions. The positions that are vacant are double that. It's about 1,400 positions that are vacant. 700 are critical nursing positions that are right now vacant at a major hospital in a major city in Canada. And so this is what we're up against. And then those workers that go into that hospital are having to make up the load for the 700 workers that they're missing. It's incredibly difficult. So what we're saying is we need to hire more workers, ensure there's good work conditions, support workers, and support ultimately people who should be able to get care when they need it. Right now, people go into hospitals not knowing when they're going to be seen, waiting for hours and hours. Many people say, maybe it's not worth it to go into hospital. And maybe we're missing really serious illnesses that people are afraid to go into the hospital to catch.
Thank you. This is sort of like trying to identify what the crisis is, and it is clearly a shortage in nursing filled positions, but also it's a funding crisis. what solutions do you propose for solving at least one of these crises?
So I'm going to ask actually Monique to weigh in on one particular issue, which is a specific provincial issue. And folks know about this. There's a cap on wages for healthcare workers, Bill 124. That cap has seriously limited workers from getting compensated fairly. It is disrespectful. These are workers that we applauded as heroes in the pandemic, and now are not being treated like heroes. They are being treated with lots of disrespect. So at the federal level, what I'll propose, and what I would do as Prime Minister, and what I'm going to force and put pressure on the federal government to do, is invest in hiring more healthcare workers. The Prime Minister himself promised in the last election to hire 7,500 more nurses and doctors. Fulfill that promise. That promise alone would make a massive difference in dealing with the crisis. It's a promise the Prime Minister made, something that we would support. That he has broken his promise and not delivered for years now. So that's one concrete step that can be taken. There's a number of others. I just want to ask Monique to weigh in on the provincial side and just share concerns about Bill 124, which is directly impacting workers in our province, and something that Doug Ford did that hurt workers and is hurting our healthcare system.
Sure. Thanks, Jagmeet. That is absolutely correct. We know that Bill 124, which is a wage suppression bill that the government put forward 4 years ago, has stagnated those wages for the last 4 years. So we have nurses who are feeling disrespected, as Jagmeet said. They were heroes, and it's their term. We went from heroes to zeros. That's the nurses that tell me that. That's totally disrespectful. Those same nurses are leaving the province. They're going to the already private services where they're getting those hours that they're able to control and be able to still have a life, where they're getting the same wages. These are for-profit places that we're losing our precious nurses and our healthcare system to. Bill 124, removing that bill immediately and getting our nurses back on track would be a great step in ensuring that we have healthcare timely when needed in our province.
Seeing no
Thanks.
more questions, we'll turn it back to you for final comments.
Yeah, I want to wrap up by again thanking Monique Taylor, the local member of provincial parliament here in Hamilton Mountain, and a big shout out to Sarah Jama, who, in addition to being a really vocal advocate for her community and for the community of Hamilton, is now also our candidate for Hamilton Centre. Thank her for being here and for her advocacy and fighting hard. I wish her luck in the campaign. Looking forward to helping her out. Thank you so much. We'll continue to fight against the private for-profit delivery of care, defend our public system to make sure people can get the care when they need it. And it shouldn't break the bank, put you into debt. You should get care when you need it, when your family needs it, and it should be public and universal. Thank you.